How to determine Sadhyasadhyata of an illness? How to determine the curability and incurability of an illness? This is the topic of this particular video. Dear NA community, press the like button and spread this particular video to maximum number of 2 Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When this is being determined, that is Sadhyasadhyata of an illness, this is being mentioned in Charaka Sutra 10th chapter in the context of Maharoga Adhyaya and Ashtanga Hridaya Sutrasthana 1st chapter in the context of the Dirghanjivitiya. When you think about the context of Sadhyasadhyata, or what do you say, that curability and incurability of an illness, this is in Sutrasthana, Hridaya Sutrasthana 1st chapter. When you think about the context of the Charaka Samhita, it is being mentioned, Etavaha Purarupani, Rupani Alpani Yasya na cha tulya guno dushyo na doshaha prakritir bhave na cha kala gunastulyo na desho durupakramaha gatireka navatvam cha rogasyopadravo na cha doshashchaikah samutpattau dehaha sarvaushadakshamaha chatushpada upapattischa sukhasadhyasya lakshanam काल प्रकृति दुष्याणां सामान्यन्यतमस्य च गर्भिणी वृद्धबालानां नात्युपद्रवपीडितं शस्त्रक्षाराग्निकृत्यानाम् अनवं कृच्छ्रदेशजं विद्यादेकपथं रोगं नातिपूर्णचतुष्पदं द्विपथं नातिकालं वा कृच्छसाध्यं विदोषजं शेषत्वादायुषो व्याप्यम् असाध्यं भक्ष्यसेवया लब्धाल्पसुखमल्पेन हेतुनाशुप्रवर्तनं मर्मसन्धिसमाश्रितं नित्यानुशायिनं रोगं दीर्घकालम् अवस्थितं विद्याद्विदोषजं प्रत्याख्येयमन्त्रितं क्रियापथम् अतिक्रान्तं सर्वमार्गानुसारिणम् औत्सुक्यारतिसम्मोहाकरम् इन्द्रियनाशनं दुर्बलस्य सुसमृद्धं व्याधिं सारिष्टमेव च. When you think about the description, there are several criteria being mentioned. Here we are going to discuss few criteria. Those criteria are the degree of Hetu exposure, severity of the development of the Purarupa, severity of Rupa, involvement of the Dushya, involvement of the Srotas, dosha gati of the vitiated dosha, duration of an illness, whether it is short or long duration, presence of the Upadrava or absence of Upadrava, certain other miscellaneous criteria. So when you think about the Hetu exposure, so here there is an image which is showing curds. When you think about the curds, if the person is going to consume little amount of the curds, there will be little dosha prakopa. If the person is going to consume large amount of the curd, that may be leading to severe dosha prakopa. Suppose if this is fresh curd as such, there may be the possibility of kapha dosha prakopa. If it is of the curd which is having the duration of more than 2 days, etc., so that will be leading to the vitiation of a pitta dosha. If the person is going to consume the curd of 2 days, which is having a sour taste, and if it is of a small quantity, then there may be the possibility of a little bit pitta dosha prakopa. Whereas the large curd, which is having the sour taste, so that may lead to more severe form of the pitta dosha vitiation when compared to the consumption of a small amount of curds. The same thing applies to other nidanas also. For example, little amount of the exercise, for example, 5 minutes, there may be little amount of the vata prakopa. Whereas exercise for more than 15 or 20 minutes, more severe form of vata prakopa may be observed. If the person is doing the exercise for more than 45 minutes, still much more form of vata dosha vitiation may be observed. So likewise, the degree of the exposure of the nidana, so that will be deciding the degree of dosha vitiation. Thereby, little dosha vitiation may have the faster cure, when compared to the those situation of a more severe degree. When you think about the severity of Purva Rupa, suppose if the person is having the diarrhea and if the person is having the symptoms related to the localized region, then such kind of the Atisara is considered to be milder form, easy to cure. When you think about the Atisara, which is having the Pururupa of more wider degree, then that will be considered to be little bit difficult to cure when compared to the first situation. Whereas the individual who is having the presenting complaint of all over the abdomen, in the person suffering from diarrhea, so that is most severe form when compared to the second situation as well as first situation. In this way, the severity of Puru Rupa will be deciding the Sadhyasadhyata of an illness. Severity of the Rupa. The same thing if the person is suffering from diarrhea and if the lady is presented with diarrhea only twice in a day, comparatively that is easy to cure. Whereas if the lady is having the diarrhea for more than 10 times, that is comparatively difficult to cure when you compare the first situation. Whereas the person who is suffering from the diarrhea for more than 24 times, that is most severe form when you compare to the second or first situation. When you think about the involvement of the Dushya, so here there are two situations. The person is suffering from skin disease and the person is suffering from joint disease. When you think about the skin disease as such, the first situation, so here we are going to observe the twak as the main affliction. So here we are going to see rasa or rakta involvement. When you think about the treatment of the disease as such, treating the person suffering from the rasa or rakta, that is comparatively easy to cure. Whereas when the person is suffering from the asthi involved or the disease, that is comparatively much more difficult to cure when you compare the rasa or rakta involvement, because the asthi affliction may suggest deeper tissue affliction, whereas rasa and rakta affliction may suggest superficial tissue affliction. Involvement of Srotas here. So in this situation, as we have said earlier, rasa and rakta dhatu affliction, we may suspect the rasa as well as raktavaha Srotas affliction. When you think about it, the treatment of rasa and raktavaha Srotas is comparatively easy when you think about the joint pain, wherein we are going to suspect asthi as well as machavaha Srotas affliction, which requires much more intense line of treatment when you compare the rasa and raktavaha Srotas affliction. Dosha gati of vitiated dosha. So here, the dosha gati specifically, there are several categories. Vriddhi, sthana, chaya, koshtha, shakha, marmasti sandhi, and the third one, that is prakrita and vaikrita, urthva, adaha, tiryagati, etc. So these are the different criteria where we are going to see about the dosha gati as such. In both these clinicians, we are going to observe the person is having tiryagati. In this particular first situation, the tiryagati is moving towards the shakha. So that is what we can say rasa rakta affliction as such. Whereas the second situation wherein the tiryagati is there, but here the main thing that is afflicted is the marma and asti as such and sandhi affliction. When you think about the tiryagati, when you think about this particular situation, that is comparatively easy to cure when you think about the tiryagati of this situation. In this way, we are going to observe the dosha gati of an illness. When you think about the duration of an illness, so the duration of an illness, this particular duration, that is, if it is of shorter duration, that is comparatively easy to cure. Whereas if it is considered to be having the longer duration, that is comparatively difficult to cure. In this way, the duration of an illness that will be helpful in deciding the prognosis of the disease as such. Whereas when you think about the presence of upadrava or absence of upadrava, absence of upadrava, that is indicative of sukhasadhyata of an illness, whereas presence of an upadrava, that is indicative of either krichrasadhyata or asadhyata of an illness. Suppose if the person is having the one joint affliction, that is comparatively easy to cure. If the person is having both the knee joints affliction, that is comparatively difficult to cure when you compare the single knee joint affliction. If the person is having multiple joint affliction, that is still even much more difficult to cure. If the person is having Majjavaha Srotas affliction, that indicates deeper Dhatu affliction, which indicates the Krichra Sadhyata or Asadhyata of an illness. When you think about the Majjavaha Srotas affliction, we may suspect there may be a possibility of Majjavaha Srotas affliction, Mula affliction also. In that particular situation, it is being considered Asthi and Sandhi. They are considered to be Majjavaha Sroto Mula. In due course of time, there may be the possibility of Majjavaha Srotas Mula affliction also. That is indicative of a Asadhyata of an illness. And regarding the miscellaneous criteria, so here one such miscellaneous criteria is age criteria. Suppose if the person is having the disease during this particular age group, 30 to 60, that is comparatively easy to cure when you compare the disease affliction in case of the childhood and in case of the elderly people. Because the people of young age, they will be having, that is the 30 to 60, they will be having the adequate amount of the dhatu nourishment when you compare the childhood as well as in the elderly people. Certain other criteria, miscellaneous criteria, they are mentioned in the text. Suppose if the lady is pregnant, then such condition is considered to be Krichrasadhya, or one dosha afflicted, that is Sukhasadhya, multiple dosha afflicted, that is Krichrasadhya to Asadhya, that is Sukhasadhya in nature, two Roga Marga afflicted, that is Krichrasadhya in nature, all three Roga Marga in nature. Suppose if the all Chikitsa Chatushpada are at their top qualities, that is considered to be Sukhasadhya in nature, or if all Chikitsa Chatushpada are not up to their, what do you say, that the top qualities, then such kind of the diseases are Asadhya in nature. Presence of Arishta Lakshana, that is indicative of Asadhyata of an illness. Presence of more severe Rogabala, that is again indicative of Asadhyata of an illness. Thus, when you think about the summing up, Sadhyasadhyata of an illness are depending upon the several criteria, wherein the term Sadhya refers to restoration of an health from the diseased condition, that too in a short possible amount of time, whereas Asadhyata of an illness, that is referring to no restoration of health from the disease. This is illustrated in this particular session based on the degree of Hetu exposure, degree of the Rupa as such, severity of the Rupa as such, involvement of the Dushya, involvement of the Srotas, and duration of the illness, and presence of the Upadrava, etc. Dear ANA community, that is what we are going to discuss in this particular session. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.